Right, 1 minute over. So if you've read and understood, considering its surgical pathology station, please tell me, what is your provisional diagnosis after reading the stem?
My provincial diagnosis is aortic stenosis
Okay.
with
Yeah.
myocardial ischemia.
All right. Okay. With or without myocardial ischemia. Okay. Please tell me, how would you confirm your diagnosis?
I will confirm my diagnosis by taking history and
Okay.
examination and do 12 lead ECG.
Yes.
Also to do uh, cardiac enzyme
Okay.
and echo
Uh,
cardiogram.
all right. Cardiac enzymes have been presented. Echo, yes, everything. What else? Anything extra that you'll do?
Mm. Also, I can do CTBE throughout BE.
What are the
Yes,
signs of aortic stenosis? No. What are the
sign
signs? Yes. Classic triad with which patient presents.
maybe syncope, orthopnea, and
You know the difference between symptoms and signs, right?
yeah,
So there'll be slow rising pulse, there'll be S4 and aortic thrill.
it's aortic thrill. Also the thrill is radiating to the root of the neck and
Okay. Paradoxical split. Yes.
yeah,
Then
and
split.
strong pulse and
Okay.
water. I think water hammer pulse.
Ejection systolic murmur, narrow PP distance, and there'll be displaced apex speed. All right. If you fail to manage this condition, what are the complications that you should expect to see?
If I fail to manage this case, could be heart failure.
Okay. And you should know the
Also,
sequence, like heart
heart failure
failure,
or
right?
left
Then
ventricular failure. Maybe it lead also to myocardial infarction, uh, syncope.
okay, syncope is layman term. It's
Yeah,
called arrhythmias.
symptoms of low cardiac output.
Okay, so
Yeah,
there could even be pulmonary edema, right heart failure. You said left heart, but once it's not managed or treated, right heart failure becomes okay. Right.
yeah.
If you could help me and read this ECG, I know it's not really good, but please
Okay.
try to read it. What do you see?
At first, I should confirm the name of the patient and age
Yes,
of the patient and medical
yes,
record number and
yes,
date of this ECG and the time of the ECG. Also, there is a barcode here. We can identify the ECG for which patient.
yes,
Also, in lead number 2, there
yes.
is a B wave. Heart rate, heart rhythm is regular.
Okay,
The rate about 1, 2. It's about 150 uh,
okay,
beat per minute.
yes.
Also, in the
Heart rate
BB,
is not
the sinus
regular.
rhythm.
It's not, is it?
R
Interval.
distance equal 2 large square between each one, and the heart rate is 150. Sinus tachycardia.
Okay. Uh,
And yeah,
yes.
uh, lead 3. This is the only thing. Maybe left heart, left. Where is the lead 3? Okay. I
Lead
should
three is,
show AVR and LF, left VR also.
do you
Cannot
see the signs of left heart failure?
left heart failure. It should show lead 1 high
Okay,
positive spike.
tell me the pathophysiology behind aortic stenosis. How does it occur?
Pathophysiology.
Yes. please?
It occur. It could be congenital or as congenital or
Or
degenerative or rheumatoid.
yes, so that
Or
rheumatoid
from
is acquired.
yeah.
Okay, then what happens? There is valve
It happens
obstruction. Then
fibrosis and colonization of bacteria around the
no right away.
valve.
No right away.
Fibrosis.
That leads to increased intraventricular pressure
The
in
battle.
order to
The battle.
maintain cardiac output.
Yeah.
Then there is ventricular valve hypertrophy. This leads into left ventricular hypertrophy. That can even lead to decreased compliance or increase. What would increase?
The heart rate.
Left ejection.
Or
What?
left ejection pressure.
Okay. That leads to, like, you have to tell me the sequence. At the end, it becomes, or it ends up with angina or the whole system. Okay. What is the treatment that you can offer this patient?
This patient could need to valve replacement.
Okay, but not right away. What would you do in order to manage this patient in this situation? You've given sublingual nitroglycerin, didn't work.
Oxygen
Okay,
and morphine
okay,
and nitroglycerin sublingual
it's
with
yes.
analgesia. Yeah,
Okay, anything else?
and maybe he need cardiac cath to visualize his condition and echo to visualize the
Echo.
aortic
Right.
surface area.
Yes. What would you see on echocardiogram? Or yes,
It could be a narrowing of the aortic valve
yes, and
or vegetation or fibrosis of the aortic valve.
yes.
It
You'll
could
only see
roll out.
vegetation if it's because of rheumatoid arthritis.
Yeah.
If it is because of aging, as then what would you see?
If it is infective,
If it is because of aging, old age, aortic stenosis.
calcification and
Then
fibrosis of the
yes,
aortic valve.
yes. Okay. Right. According to, all right. Would you, all right. Okay. What else would you do for the patient?
Also to also he need also cardiologist
Opinion?
consultation
Why?
opinion to evaluate his chest pain
Why? Okay.
or
Well,
to treat any symptoms of heart of the heart failure.
so you'll send a request for the sake of management to the medicine department or the cardiologist to look the patient or take over the patient rather. What are the risks that you have to keep in your mind as a surgeon when operating on a patient who presents with aortic stenosis?
The patient with aortic stenosis, he should be optimized before any elective surgery.
Okay.
Also to evaluation and optimization. Also, this is the most important thing for his condition.
Yes, you'll consult with the anesthetist.
Anesthesia and cardiologist. Yes.
And theater team to decide to operate on the patient or not. Thank you.
Yeah.